Migraine is a disorder of the brain where the patient suffers from unilateral pulsating headache of moderate to severe intensity. It lasts anywhere between 4 to 72 hours, up to maybe three days, and it may or may not be associated with nausea or vomiting. Migraine is a fairly common disorder. The incidence in India is approximately 10 million people suffer from migraine per year. Uh, Roughly, the incidence is about 30%. So if there are three people in this room, one of us will have headache. 30%. One in every three persons will have migraine kind of headaches. We do not really know what causes migraine. There may be some kind of a genetic basis to it. Usually, we have a history where the mother or the father or the brother and sister also have migraine headaches. In these headaches, there's some changes in the brain, in the chemical, the neurotransmitters to the brain, in the electrical activity of the brain, which causes or precipitates an attack. Classically, there are four stages of migraine: the prodrome, the aura, the attack itself, and the postdrome. Prodrome usually precedes the migraine headache by 1 or 2 days. It may or may not be there in every patient. It usually causes a little bit of weight gain, fluid retention, little bit of irritability, change in mood, little bit of depression, body aches, which may last for a couple of days, and after that, the attack may be precipitated. The aura accompanies the migraine or just precedes the migraine. It occurs over a period of 1 or 2 minutes. Usually, patient describes of visual symptoms in the form of flashing of light, bizarre shapes which the patient sees. Sometimes there's a field cut. They may see that they just stop. They have areas on the field where there's no vision at all, which lasts for about a minute or two before the migraine attack is triggered off. The aura can be also be in the form of tingling in the hands and legs, again, which can accompany the headache or just precede it by a minute or so. The attack itself consists of the headache. That's the worst part where the patient suffers. Usually unilateral throbbing headache lasts anywhere between 4 to 72 hours with or without vomiting, with or without accompanying photophobia and phonophobia. Photophobia means the lights, the bright light do not look so good, or loud sounds do not sound so good. So they may have photophobia or phonophobia along with the headaches and vomiting. The postdrome occurs after the headache has subsided, and usually patient feels very tired, drained out, lethargic, again lasts for a day or so. What is important is that all the patients need not have all the four stages. Headache is consistent. Headache most patients will have, but the aura, the prodrome may not be there in all the patients. This is very important to understand. The definition which I use for migraine, we use the term primary headache. Primary headache means it is caused by migraine and nothing else. But we have to rule out secondary causes of headache, brain tumor, bleeding inside the brain, or something else inside the brain. So there are some warning symptoms, there are some red flags which tells the doctor that your migraine or my migraine may not be migraine, but maybe something more sinister. These issues or these symptoms are if the headache for the first time in life. Remember, migraine is a chronic headache, it's not an acute headache. So if a person is for the first time in his life is having severe headache associated with vomiting and nausea, he or she should be investigated for some other cause for headache. If a person has, for example, loss of consciousness, the red flags for whether it is not migraine can be loss of consciousness, double vision, change in voice, slurring of voice, weakness of the hand, difficulty in walking, difficulty in balancing. If a person has fever at the onset and there's a lot of neck stiffness, a lot of pain in the neck, again these are red flags which are telling us that this may not be migraine, this may be something else. So migraine is a diagnosis of exclusion. That means you ruled out more sinister or more dangerous causes of headache before we make a diagnosis of migraine. So this is a very commonly asked question in the clinic. If I have migraine, what should I do? So there are some do's and don'ts, and let me just go through the list of what I usually advise the patient. First is, a lot of these patients have photophobia and phonophobia. That means they're intolerant to bright light and loud sound. It has been scientifically shown that bright light stimulates specific cells in the retina, which converge on the brain on the pain receptors in the brain, and they can worsen the migraine headaches. So usually advise to dim the lights or to just switch it off and go to sleep. If there's a loud music, if the children are playing with a loud sound in the house, try to bring down the sound. So number one, avoid loud sound and bright lights. Turn off the lights, try to sleep it off, try to have a quiet environment. Number two, hydrate yourself. Now, it's very important. Water as a hydrating agent is very important for reducing the incidence of migraine, and even during an acute episode. Drink plenty of water, especially nowadays when the summer season, when the temperatures outside are touching record highs. Hydrate yourself well. There are some people who do not like to drink too much of water, and for them I usually advise that just put a slice of lemon in the water. It becomes quite tasty and you can drink as much water as you want. Or put a little bit of fruit juice in the water and drink as much as you want, but hydrate yourself. Increase the amount of fluid which you are taking. Number three is apply cold or hot compresses. Now, two areas. One is the forehead and second is the neck. These are the areas where the muscles are tight, and some people respond to cold compress, some people respond to hot compresses. Whatever suits you. If you're using a cold compress, remember to put a cloth in between the skin and the cold compress. Otherwise, the cold ice pack numbs the skin and it can even damage the skin if applied for a long period. Hot compresses, again, they help, again applied in the same places. I usually advise my patient to take a warm water shower and just try to switch off the light and sleep it off. The migraine should become much less. Okay, so that is compresses, hot or cold compresses. Massage. A lot of patients, they respond to just massage in the temple area, and this is the area which we advise the patient to massage, which helps the patient, the neck area and the temple area. There is just a small caveat that some patients have a lot of skin sensitivity. This is known as allodynia, where just touching the skin or the hair brings out the pain. So these patients do not respond to massage, and we should not offer them massage. These are people who do not have the skin hypersensitivity who will respond to massage either in the temples or of the neck. Caffeine, a cup of coffee is a good migraine aborter. Okay. Meditation helps in aborting an attack and also helps in preventing an attack. It has been shown that out of every 10 attacks of migraine, 8 are precipitated by stress or tension. So another simple breathing exercises like mindfulness, simple breathing exercises where you just try to breathe and concentrate on your breath going in and out is a good way of relaxing your mind, of relaxing your muscles, and of aborting an attack of migraine. And if you do it on a regular basis, even prevents repeated episodes of migraine. Meditation, mindfulness, strongly recommended. Physical activity. Now, physical activity is good to prevent a headache, but once you have a headache, once you're having a migraine, exercise is not really recommended. We usually advise the patient to take rest. The last thing is lavender essence. Now, lavender, there have been trials, there have been small studies in Iran, Middle East, which have shown that lavender essence during an episode and 10 to 15 minutes daily prevents migraine and aborts an acute episode of migraine also. So to just sum it up, if you have a migraine headache, take a hot water shower, take a cup of coffee, massage your temples, apply hot or cold compresses, and just try to sleep it off. You can take any conventional painkiller which helps you or which gives you relief, but there are specific group of drugs made for migraine. They are known as triptans. These are available as rescue medicines. They are available as injections, as inhalers, as tablets, and these abort a migraine attack within 15 to 20 minutes, depending on how the route of administration. These are available. They are not conventional painkillers. They will not help you if you have pain because of any other reason. But for migraine, they are very specific. They're known as a group of drugs known as triptans. So, if we believe that, if we understand that migraine is genetic, and if we believe or we understand again that we cannot change our parents, then we should understand that migraine will not go away. It will not be cured. No, the answer is no. Brain tumors are a totally different disease. Migraine does not cause brain tumors. Patients of migraine are not predisposed to brain tumors. The answer is no. Migraine itself is not fatal. It does not cause death. It does not cause crippling. But there's some forms. There are some rare forms of migraine which a patient after a headache can develop weakness of one hand or one leg, or they're more prone for cardiovascular mortality. Not all migraine, but some rare forms of migraine, patients can develop a cardiovascular morbidity or even weakness of the hands. So, in conclusion, migraine is very common. There's nothing to be worried about. Even I have migraine. There's nothing to be worried about. It can be controlled. It can be, to a large extent, the effect of a headache can be mitigated with medicines and with lifestyle change. And these people lead a totally normal life. Totally normal life. There should not be any worry or any issues for long-term problems with this problem of migraine.